Hello and welcome to the Dissect and Connect podcast. I'm your host, Mike Wade. This is the podcast where we explore population health issues impacting your community. Dissect and Connect is a service of New River Valley Community Services and the Montgomery County Prevention Partners. Are you searching for a career opportunity with purpose? One where you get to have a positive impact on the lives of others every day? If so, we'd like to hear from you. New River Valley Community Services is one of the largest employers in beautiful and scenic Southwest Virginia. As the public provider of behavioral health services to residents of the New River Valley, our agency employs a workforce of diverse, dedicated, and deeply compassionate professionals. We have a wide variety of positions currently available, and benefits include enrollment in the Virginia Retirement System, paid health and life insurance, flexible schedules, generous paid time off, and much, much more. To find the job that's right for you, visit our website at nrvcs.org/employment. That's nrvcs.org/employment. Dr. Rosanna Breaux is an assistant professor of psychology and the director of the Child Study Center at Virginia Tech. Clinically, Dr. Breaux conducts and supervises individual and group therapy, as well as comprehensive psychoeducational assessments for children and adolescents. Dr. Breaux's research focuses on the social, emotional, and academic functioning of children and adolescents, particularly those with ADHD. She is also interested in understanding the role parents play in shaping the social, emotional development of children and adolescents with a focus on emotion regulation. So, Dr. Breaux, welcome to the Dissect and Connect podcast.
Thanks so much for having me.
Before we jump into the topic of conversation, I was wondering if you might share a little bit more about yourself.
Sure. So I am an assistant professor of psychology at Virginia Tech and the director of our Child Study Center. So I wear many different hats in terms of being a clinician, a researcher, a teacher, but primarily work with families of children and adolescents ages 2 to 16 with various social, emotional, as well as academic difficulties.
Fantastic. I'm just curious, what made you choose this particular line of work?
That's a great question. I think, throughout my adolescence, I was kind of toying with, did I want to be a teacher? Did I want to be a school psychologist, a clinical psychologist? I knew I wanted to work with kids and found myself, drawn to helping kids who were struggling, be it either behaviorally or academically, through various jobs and volunteer positions. And so I think kind of throughout exploring and being exposed to research then in undergrad kind of paved my way here, combining all those different interests over time.
So moving on to the topic at hand, for folks who may not be familiar with it, would you mind giving us a brief explanation of what dysgraphia is?
Sure. Yeah. So the term dysgraphia is kind of used colloquially to describe a broad range of difficulties that have to do with writing. So it's typically things like legible handwriting, actual physical formation of letters, but also is sometimes used to refer to difficulties with spelling. One of the things that's really important, but also that causes a lot of confusion, is that dysgraphia is not actually a diagnosis in the sense that a psychologist would not formally diagnose a child with dysgraphia. It actually falls under a specific learning disorder in written expression is the diagnosis that you would see given.
How common or prevalent is dysgraphia?
It's hard to get exact prevalence rates. We know that up to about a third of children experience some difficulty with writing. And so, could fall under this dysgraphia label, but it's closer to probably about 10 to 15% of children that would actually receive a formal diagnosis and support through school so that it's at a level that is impairing. So we're talking about more than just sloppy handwriting here. We know lots of kids have sloppy handwriting.
Right. So what are some preliminary signs to look for, indicators?
Yeah. So some of the things that we're often looking for is kind of true difficulties with the fine motor skills. So this could be that it takes a really long time or is really challenging for the child to form their letters. You'll often see kind of immature hand grip in writing. So there's different tests that we can do to assess graphic motor abilities, as well as to, so that's fine motor skills, but also to be able to disentangle, is this an issue of what's referred to as visual spatial integration? So being able to actually, be seeing something and forming it on paper versus is it just a fine motor deficit?
Okay. And then I'm sure it varies by child, but on average, is there a age range when this can be detected in young people?
So, typically you're not going to be diagnosing an SLD until school age. So not really younger than 5 or 6 would really be the low end. But we do see high levels of prevalence rates kind of across childhood and adolescence. And it's not, there used to be kind of this belief that children's handwriting got better with age. One of the things that is a blessing and a curse of technology is I think we're seeing that be less the case because students are just having to write less.
Right.
You're starting typing now in elementary school rather than having to be writing essays.
A lost art in some ways.
Yeah.
So for a parent or a guardian that might have concerns that their child is living with dysgraphia, how do they go about seeking a qualified diagnosis or finding out for sure one way or the other if that is in fact what their child is living with?
It's a great question. So there's a couple of different approaches for how families can go about this. The first place that I would go is reaching out to your child's school. Mm-hmm. So the formal way to do it is requesting what's called a child study meeting to say that you have concerns about a potential learning disorder and would like for your child to be evaluated. Many schools are able to do those assessments in-house, but many schools also don't have the resources for it, or they might deem that your child might not be eligible based off of different pieces of data. Typically, they reach out to teachers, look at standardized test performance, academic performance so far. And so families can choose, if that's the case, then to seek an outside evaluation. So there are a lot of assessment clinics. I will say that right now, the wait list for many child assessment clinics is about 6 months, sometimes even up to a year out. Mm-hmm. And so I think that's one thing for families to be aware is that this is sometimes not a very quick process. But what that outside evaluation would look at is they typically are going to do these different tests, look at things like cognitive abilities, academic abilities, fine motor skills, to be able to really comprehensively assess and then formally diagnose this difficulty.
So I guess to recognize it would be one thing, but then what do you do about it? Can it be effectively treated or cured, for lack of a better term?
Yeah, I think we have some great strategies to help improve, as well as different assistive technologies and accommodations to help make it less impairing. And so for younger kids, you're often going to be more likely to do those interventions. So working with like an occupational therapist to help improve fine motor skills, letter formation, often using, multisensory. Drawing, forming the letters in the sand, doing skywriting rather than not just formally writing it how we typically would. So different strategies to help improve with the letters formation and build up the muscle skills if there truly is a fine motor deficit. But then a lot of what's done is also accommodations. So things like being able to use a scribe, which is when a teacher or someone else will actually write down what the child dictates for answers to try to help reduce the impact of the fine motor deficit or the time that it takes for them to write on things like exams. Being able to type up things rather than write is a common accommodation, although that's becoming almost universal for many students at this point. And so there are different strategies, things like providing students with larger lined papers rather than the standard rule letters, having more formal boundaries that are larger to really help with the letter formation. So there's a range of different things that schools can implement. And if there's a formal diagnosis, oftentimes that's implemented through an individualized education program or IEP. But sometimes you'll see more informal accommodations like a 504 plan that are going to be used, and particularly for students with autism spectrum disorder or attention deficit hyperactivity disorder. So ASD and ADHD, we often see this dysgraphia present. And so they sometimes have some of these more informal accommodations just to help with the poor handwriting and difficulty with writing, even if there's not a formal specific learning disorder diagnosis.
Is it fair to assume that failing to recognize this and to seek supports could eventually lead to other problems or challenges?
I never want to make an assumption. I think it's definitely a possible outcome. We know that there's lots of outcomes. I think the big thing that I always worry about is when there aren't supports or if there isn't intervention in place, is that it makes, if we think about academics, you're writing 90% of the time. And so it's involved across so many different things. And it can just make school really frustrating, doing homework really challenging and upsetting. And so it can build kind of a negative association with school, and trying to prevent that from happening, I think would definitely be one of my big concerns in terms of not intervening.
Right. You've talked about some of the strategies and interventions that schools can provide to young people who struggle with this issue. Are there more general things that schools and or communities can do to support individuals living with dysgraphia?
Yeah, I think parents can be doing some of these strategies at home as well. Even things in terms of helping, like if you're seeing more of a grasp grip where they're like clutching their fist with the pencil and trying to write, trying to help them work more on a traditional pincer grip and writing and having them practice to improve. It's a delicate balance. I'm not saying, write lines on a chalkboard every day, because that's also going to make the child kind of hate what they're doing. But especially, we're getting close to summer break. And so that's a great thing that even if it's once or twice a week, being able to work on that, different small things to improve fine motor skills. So, whether it's using like a needle and thread to bead, beads to make bracelets, like all of those activities that really help with that hand-eye coordination and fine motor skills, can be really helpful. And so I think it can also be done in a fun way for younger kids, especially.
Yeah, fun always helps.
Yes.
Do you have any suggested or recommended resources on this topic that you could share?
Yeah, I can send you some different ones. I think, there are a lot of things online. Understood.org is one that comes to mind, especially, and they actually have, some different articles specifically posted about dysgraphia, difficulties with handwriting, and speaks to some of what you were talking about in terms of things like doing mazes or, practicing writing, different things. Playing, I mentioned this multi-sensory integration that OTs often use. You can do some of that at home as well. Creating like with foam. And so they have all these fun different strategies that families can look at. So that's understood.org. Would probably be the first one that comes to mind, but I'm happy to send you some additional, like more specific ones.
Yeah, sure. And once I have those, I'll include those in the show notes for today's episode.
Sounds great.
Thank you for that. Finally, any parting words of wisdom to share with our listeners?
I think, the big thing is that identifying when their child is struggling and not being afraid to ask for help. Really the worst thing they can say is no. I think parents often don't recognize that, like, they can be pushing and requesting this. Talking to your child's teacher, even informally, early on is a good way to start at those parent-teacher conferences, but also recognizing that this can take some time. That is the thing that I have a lot of empathy for, but also think is important for parents to be aware that it can sometimes take 3 to 6 months for really, even once it's identified and the school's working on it, for supports to be in place. And so that's where these strategies and things that parents can do at home can be really helpful in the meantime.
Well, fantastic. And I have learned so much in this conversation, Dr. Barrow, and I just wanted to thank you for your time today and shedding some light on this important topic, and would love to have you back on the show at some point in the future.
Wonderful. It was very nice speaking with you.
We hope you've enjoyed this episode of the Dissect and Connect podcast. To learn more about Montgomery County Prevention Partners, our New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org/podcast.